Welcome back to just my channel of an everyday life of an Aspie. If you're following me right now, just recently I'm just doing all about series of your chronic illnesses and whatnot, hopefully so that we can gain a better understanding and knowledge of what to look out for, of any warning signs and symptoms, basically, because as I believe that, we don't wish for anyone to obviously suffer or go through this alone regardless, so this is why I'm here, hopefully to address the warning signs and symptoms and how to go about it with my tips and tricks, along with just some tips and advice regardless what these topics are. So it has been brought to my attention that obviously, as I said so many times before, that I'm hoping to bring out some nitty gritty topics either next week or the week after of what I feel on my heart to share. So bear with me for what I want to share with you all regardless what they are, and hopefully we can respect one another's differences of opinion when I do bring it out. Obviously some of it will be based on my everyday personal experiences of what I've been through, and hopefully I can't stress it enough to spread the word and share it out to you guys, because I don't forever condone anyone to actually go through the same thing that I went through, sort of thing, and hopefully that we can learn from each other along the way. Also, just as a disclaimer before I continue, is that I'm no medical doctor. I'm just normal Joe blogs doing my life story with Asperger's syndrome, OCD and the like, as well as spreading mental health and awareness on everyday topics that I feel close to my heart to share. So if you see any warning signs and symptoms in regards to these different topics, be it general health, mental health, the like, seek professional help for yourself or your loved one, or seek an opinion. As I keep trying to stress it enough, I don't forever condone self-harm in any way. So before I begin this, obviously this one's all about series, and this one's all about heart attacks. Just to summarize up what I was talking about in the last one, I was talking about what is a heart attack, the differences between certain heart attacks, and the clinical medical terms that I use for different types of heart attacks, versus basically what to look out for when there is a heart attack that's occurring, the differences between heart attacks in men and women, basically, and hopefully that we can gain a better understanding. So this one's part 2. Obviously this one's going to cover the diagnosing of the heart attack versus the treatments, as well as some other bits and pieces. So hopefully you're liking it so far. Smash that like if you do, so I know that you guys are engaging with me, and hopefully we're learning something along the way. As always, also just to bear in mind that there will be pictures popping up on the top of the corners of my screen to illustrate certain diagrams, especially as I'm breaking these into series, so that you gain a better understanding of what I'm sharing with you all. So hopefully it will be obvious to you or to someone you know of to share. These can be shared around in classes, whatever purpose you may feel to do. So before I run out of time, enough jabbering, let's get on with this. So diagnosing a heart attack, what to expect. Obviously, basically, the hours following a heart attack can be really scary and confusing for people that do experience heart attacks, right? Your medical team may be so busy working to get you better that no one can stop and explain what is really going on with you, because obviously it's in a frenzy, it's all sudden. So your first question might be, what has just happened? Why am I lying on the floor? You become dazzled, dazed, confused, probably scared and all that. This will be a typical normal response, obviously, when you have experienced something this scary, regardless it is. Obviously, it's okay to ask a lot of questions so you can find out what's going on, because obviously you need to, as I say, listen to your body, because obviously your body is telling you something when something's wrong. Your doctors will have questions also too, to you, as they seek to diagnose the underlying causes of your heart attack when it does happen. Okay, moving on though, I will now share the following with you all, and hopefully we can gain a better understanding and knowledge on this. So I'll be explaining right now the 2 basic types of heart attacks as mentioned before, as well as the diagnostic steps to follow and go through. Walk through some common question and answers that people may be, thinking out loud or wanting to ask themselves, or even maybe to me, basically. So just some additional questions you might want to ask to your doctor. Okay, obviously, basically, as I said before, there are certain heart attack types to look out for, as well as diagnosis. So therefore, especially now in this section, a heart attack is also called a myocardial infarction, sometimes simply referred to as an MI, which hopefully a diagram will show you the differentiation between the heart attack and this. A heart attack occurs when a blockage of one or more coronary arteries reduces or stops the blood flow to the heart, which starves the part of the heart muscle of oxygen. The blockage might be complete or partial, either or. A complete blockage of a coronary artery means you suffered an STMI heart attack, which stands for ST elevation myocardial infarction. A partial blockage will be an NSTEMI heart attack, which obviously will stand for a non-ST elevation myocardial infarction. Diagnostic steps basically differ from these two of the STMI versus your NSTMI heart attacks. So although there can be some that will overlap from one another regardless. So some hospitals use a procedure called percutaneous coronary intervention, which is a medical term meaning of treating heart attack. About 36% of hospitals in the US are equipped to use PCI. At a hospital though, however, that uses PCI, you would likely to be sent to the department that specialises in cardiac catheterization, usually called a cath lab, for a diagnostic angiogram to examine your blood flow to your heart and test how well the heart is pumping around the body with your blood. A hospital that doesn't use PCI, however, might transfer you to one that does, or it may decide to administer drugs known as fibrinolytic agents to restore the blood flow that has been lost. You might be given an angiography, an imaging technique used to see inside your arteries, veins, and heart chambers. Important. Remember, like any other diagnoses that you want to, rule out, or symptoms you want to rule out, try not to diagnose yourself, obviously, even though sometimes it's hard not to when you feel you're losing trust in doctors and whatnot. Always dial 111 if you think you might be experiencing a heart attack or having one. The MES crew in your ambulance will route you to the right hospital based on your everyday location. Now, the answers to some questions, basically, of the common questions that people may ask are of the following. Why do I have to submit a bunch of tests? Obviously, tests will help the doctor to determine if a heart attack has occurred, how much your heart rate was damaged, and what degree of coronary artery disease or CAD you might have. The tests screen your heart and help the doctor determine what treatment and lifestyle changes you will need to keep your heart healthy and prevent any serious future damage of these medical events. What's the difference between invasive and non-invasive tests? A non-invasive cardiac test measures your heart's activity through external imaging and electrocardiography. Invasive tests includes drawing and tasting samples of blood and inserting and threading a thin hollow tube called a catheter into a blood vessel to get an inside view. Where can I see the big picture? How does this all fit together for me? Obviously, to understand this test, you may have to undergo to find out if you had an heart attack, how much damage was done, and what degree of coronary artery disease you may have. So basically, I'll be sharing more about the diagnostic tests and procedures to share this out so you can get a better understanding. What types of treatment will I get after a hospital diagnoses my heart attack? Obviously, if you had a heart attack, you may already have certain procedures that's been put into place to help you survive a heart attack, basically, and diagnose your condition. Thrombolysis. Many heart attack patients have undergone thrombolysis, which is a procedure that involves injecting a clot-dissolving agent to restore the blood flow in a coronary artery. This procedure is administered with a few, usually 3 hours of a heart attack. Obviously, another one is basically coronary angioplasty, or coronary artery bypass graft surgery, or CABG for short. If thrombolysis treatment isn't done immediately after a heart attack, many patients will undergo this form of treatment or surgery later to improve the blood supply to the heart muscle, obviously. So, additional questions you may want to ask your doctor. Even though we know doctors are busy and they're trying to do their best to, meet their patients' needs, they do really want to help us to rule out anything, regardless if it's a heart attack or whatever else we're suffering from. We can help them also by coming up to each appointment prepared with any questions we may have about our diagnosis, the treatment, or other elements of medical care. Here are some questions you may want to basically consider for heart attack patients, especially want to ask, often having during a heart attack, diagnosis process. So the questions they're more likely to ask: what kind of heart attack did I have? Did it damage my heart permanently? Why did this happen to me? Am I at risk of having another one soon? Could you explain the treatments and medicines I'll need to help treat this or manage this? Should I worry about my medicines that will interact or have any side effects with any other medications I may be taking? How long will I have to stay in the hospital? What physical limitations will I have while I have to recover from this? Will I be able to return to a normal life? What is cardiac rehab and when can I start? Okay, for the diagnostic tests and procedures, however, as we know, heart attack patients may be asked to undergo a number of diagnostic tests and procedures regardless what it is. So as I shared before, by learning what these tests are and why they're being done, you'll feel more confident in yourself and you'll be able to hopefully gain the trust in your medical specialist team that's doing these tests for you. These tests are important and help your healthcare provider determine if a heart attack occurred, how much your heart was damaged, and also what degree of coronary artery disease you may have. Your heart attack may have been the first symptom that you have CAD. The test screen will your heart, obviously, and help the doctor determine what treatment and lifestyle changes will keep your heart healthy and prevent any serious future damage in likelihood of these medical events in you. As I said before, there are non-invasive and invasive diagnostic tests. Obviously, the non-invasive diagnostic testing will involve imaging, may involve having a needle stick such as an intravenous injection of a conscious agent. Invasive procedures can include insertion of a tube, device, or scope. If you have had a heart attack, you may have already had certain procedures to help you survive your heart attack and diagnose your condition. For example, many heart attack patients have undergone thrombolysis, a procedure that involves injecting a blood clotting agent or blood clotting dissolving agent, I should say, to restore the blood flow in a coronary artery. This procedure is administered within a few, usually 3 hours of a heart attack. If this treatment isn't done immediately after a heart attack, many patients will need to undergo coronary angioplasty or coronary artery bypass again later to improve blood supply to the heart muscle. Okay, what the test does. Okay, so obviously records the electrical activity of the heart, including the timing and duration of each electrical phase in your heartbeat, which is your ECGs and all those reasonings. The reason for this is obviously this will determine that a heart attack has occurred, helps predict if a heart attack is developing, and monitors any changes of your heart rhythm. Your invasive procedures, if you want to know more that I'm sharing, is your cardiac catheterization. What this does is examines the inside of your heart's blood vessels using special x-rays called angiograms. Obviously, hopefully I'll be able to have an image what this looks like to gain a better understanding, but what it looks like, as I said, is a thin hollow tube basically called a catheter that is threaded from a blood vessel in the arm, groin or neck to the heart. Dye is then ejected from the catheter into blood vessels to make them visible when you have an x-ray. Usually it takes 2 to 3 hours. The reasoning for the test as follows is evaluation of chest pain to show if the plaque is narrowing or blocking your coronary arteries, which is called your coronary angiography, which I've already shared a little bit what that is in my previous video of the stroke. So if you want to, I'll link that to the description or have an information bar showing to link you to that page or video. Another one is to perform a percutaneous coronary interventional PCI as mentioned, such as coronary angioplasty with stenting to open up blocked segments of a coronary artery. This can also measure blood pressure within the heart and oxygen in blood. Blood tests. Obviously, blood testing may include the following: your cardiac enzymes, which are your, including your troponin and creatine kinase, C-reactive protein or CRP, fibrinogen, homocysteine, lipoproteins, triglycerides, brain natriuretic peptide or BNP, and prothrombin. The reasons for the testings of this one is to confirm that a heart attack has occurred and determine any of the extent damage. It will then assess any future risk for coronary artery disease. Provides information on the time it takes for the blood to clot. This is an introduction, obviously, to the common tremors you may have experienced following the diagnosis as a heart attack patient. Heart attack treatment is obviously a complex process, but this is a bracelet primer to help you to talk with your doctor and other healthcare providers to provide, about your needs and any questions that may arise. Okay, now obviously I'm going to be covering in this one is the typical types of heart attack treatments, types of drugs, common heart attack types and treatments, the type of heart attack. Also, obviously, as mentioned so many times before, is called MI. you experience determines the treatments your medical team will choose. A heart attack occurs when a blockage in one or more coronary arteries reduces or stops the blood flow to the heart. So the muscle heart or muscle. The blockage might be complete or partial. A complete blockage of a coronary artery means you suffer from an STNI, blah blah. But as I said before, it's always important not to diagnose properly. Always call 111 so they can take you to basically what it is. So obviously treatments differ to, although they can be overlap. Obviously, I've already mentioned that, haven't I? Yes, I have. So yeah. Obviously, the common treatments basically for your common heart attack treatments is angioplasty, which obviously I've listed, is special tubing with an attached deflated balloon that is threaded up to the coronary arteries. Angioplasty laser, which is similar to angioplasty, except the only difference here is that the catheter has a laser tip that opens the blocked artery. Artificial heart valve surgery replaces an abnormal or diseased heart valve within a healthy one. Atherectomy, similar to angioplasty again, except that the catheter has a rotating shaver on its tip to cut away from plaque from the artery. Bypass surgery treats blocked heart arteries by creating new passages for blood to flow to your heart muscle. Cardiomyoplasty, an experimental procedure in which skeletal muscles are taken from a patient's back or abdomen. Heart transplant obviously will remove a diseased heart part and replaces it with a donated healthy human heart. Minimally invasive heart surgery, an alternative to standard bypass surgery. Radiofrequency ablation, this is a catheter with an electrode at its tip that is guided through the veins to the heart muscle to destroy carefully selected heart muscle cells and very small ilia. Stent procedure, obviously, is a wire-mesh tube used to prop open an artery during angioplasty. Transmyocardia revascularization, or TMR. A laser is used to drill a series of holes from the outside of the heart into the heart's pumping channel. In addition to these above treatments, you might hear about the implantable medical devices being used to treat certain heart attacks. So yeah, types of drugs that may be used. Heart attack, again, treatments will involve a variety of drugs. The list below, hopefully, of what I'm sharing with you will be providing you a quick overview of the common types. Basically, your doctor will then decide which is the best treatment for you in the combination of basically for your situation, regardless of what it may be. And they are as follows: anticoagulant used to treat certain blood vessel, heart and lung conditions. Antiplatelet agent keeps blood clots from forming by preventing blood platelets from sticking at another. Antiogens converting enzyme or ACE inhibitor expands the blood vessels and decreases resistance by lowering levels of angiotensin II, which allows the blood flow to flow more easily and make the hearts work easier or more efficient. Angiotensin II receptor blocker, or they usually call them beta blockers, I think, from memory, rather than lowering levels of angiotensin II as ACE inhibitors do. These receptor blockers prevent the chemical from having any effects on the heart and blood vessels. This keeps the blood pressure from rising. Angiotensin receptor neprilysin inhibitor. Neprilysin is an enzyme that breaks down natural substances in the body that opens narrowed arteries. By limiting the effect of neprilysin, it increases the effects of these substances and improves artery opening and blood flow, reduces sodium retention and decreases strain on the heart. Beta blockers decreases the heart rate and cardiac output, which lowers blood pressure and makes the heart beat more slowly and with less force. Combined alpha and beta blockers are used as an IV drip for those patients experiencing a hypertensive crisis. They may be prescribed for outpatient high blood pressure use if the patient is at risk for heart failure. Calcium channel blocker interrupts the movement of calcium into the cells of the blood vessels, may decrease the heart's pumping strength and relax blood vessels. Cholesterol lowering medication. Various medications can lower blood cholesterol levels, but drugs other than statins should be only used for patients in whom statins are not effective enough or who have serious side effects due to statin therapy. Due to less preparation, increases the force of the heart's contractions, which can be beneficial in heart failure and for irregular heartbeats. Diuretics causes the heart to get rid of itself of excessive fluids and sodium through urination. Helps to relieve the heart's workload. Also decreases the buildup of fluid in the lungs and other parts of the body, such as the ankles and legs. Different diuretics will remove fluid at varied rates and through different methods. Vasodilator reflects blood vessels and increases blood supply of the oxygen into the heart while reducing its workload. Can come in pills to be swallowed, chewable tablets, and as a topical application, which is your creams. Obviously, for treatments and surgeries, basically, hopefully, even though most of this is just the last of it, if you have had a heart attack, you may already have certain procedures to help you survive through your heart attack and diagnose your condition. For example, many heart attack patients have undergone, as I said. Okay, for this one, obviously, I think from memory I may have done this. For the PCI balloon angioplasty and coronary balloon dilation, hopefully I've got an animation to show you what angioplasty is all about. But what the procedure does, as I said, is a special tubing with an attached deflated balloon is threaded up the coronary arteries. The balloon is inflated to widen blocked areas where the blood flows to the heart muscle has been reduced or cut off, often combined with implantation of a stent to help prop the artery open and decrease the chance of another blockage. Considered less invasive because the body is not cut open. This lasts for 30 minutes to several hours, often requires an overnight hospital stay. The reason for the procedure is greatly increases blood flow through the blocked artery, decreases chest pain, which is your angina, increases ability for physical activity, reduces risk of a heart attack, can also be used to open neck and brain arteries to prevent any strokes. Angioplasty laser obviously is similar to angioplasty, that the catheter has a laser tip that opens the blocked artery. Pulsating beams of light vaporizing the plaque buildup. The reason for the procedure obviously increases blood flow through the blocked arteries. Artificial heart valve surgery, also known as heart valve replacement surgery. What this procedure does, replaces an abnormal or diseased heart valve with a healthy one. The reason for this procedure is restores function of the heart valves. Cardiomyoplasty, what the procedure does, is an experimental procedure in which skeletal muscles are taken from the patient's back or abdomen, then they are wrapped around an ailing heart. This added muscle, aided by an ongoing stimulation from a device similar to a pacemaker, may boost the heart's pumping motion. Reason for this procedure is increases the pumping motion of the heart. Atherectomy, what this procedure does, is again similar to angioplasty, except the catheter has a rotating shaver on its tip, away from the plaque from the artery. Reasons for the procedure: increases blood flow through the blood artery by removing plaque buildup. May also be used in carotid arteries, which is your major arteries of the neck leading to the brain, to remove plaque and reduce risk for stroke. Radio frequency ablation, obviously, last but not least, also known as catheter ablation. What this procedure does is a catheter with an electrode with its tip is guided through the veins to the heart muscle with real-time moving X-rays, fluoroscopy displayed on a video screen. This catheter placed at an exact site of inside the heart where the cells give off the electrical signals that stimulate abnormal heart rhythm, then mild painless radio frequency energy similar to a microwave heat that is transferred or transmitted to the pathway but destroyed carefully. The reason for the procedure is preferred treatment for many types of rapid heartbeats, which is your arrhythmias, especially cerebroventricular tachyarrhythmias. So this quickly ends basically the second part of all about heart attacks. Leave a like for thumbs up for support, comment below, feel free to share these videos around, feel free to subscribe to my channel if you haven't done so, feel free to turn on the notification bell so you know what I'm up to. So no further ado guys, follow me on the social media sites that will be linked below, also in the description. No further ado guys, thanks for the support, thanks for watching, do what you love what you do. Until next time, Aspie signing out, I'll see you all again soon, ciao.